Hi, Duncan here, Dr. Evil. For the last few months, we've been doing an awful lot of work at our Wimborne branch, and we're very grateful to our clients for putting up with the disruption. Well, most of it's finished now, so I thought you'd like to follow me inside and see what we've done. So here we are in our new waiting room, and we've opened it right up to give us a lot more space and hopefully a nicer environment for dogs and cats that come in here. In fact, we've got a cat waiting area now behind me here, which is just for cats to keep them away from dogs that might worry them or stress them. And also the door behind is to our cat-only consulting room. Okay, so here we have our dog seating area, which we've kept nice and spacious and open, so there's room between dogs if they're a bit worried. You don't have to be on top of each other. And now, if we walk through this way, past our scales, into our newly refurbished consulting rooms, I'd like to show you in there. We're very proud of our new consulting rooms. They've been completely repainted and brought up to a nice, clean, modern standard. We have new vaccine chiller cabinets for storage of the vaccines, and new consulting tables as well. So we look forward to seeing you in here. But what I'd also like to do is give you a bit of a behind the scenes tour now. So if you'd like to come with me, we'll go through this door into the clinical areas. So here we are in our prep area. This is the beating heart of the veterinary practice. We've again completely refurbished this to bring it up to a clean and modern standard. And I'll just explain a little bit about what goes on in here. When your pet's first brought in to the clinic, they come into here, we assess them, check their health, the temperatures, listen to their heart, things like that. Put the name on this board and record what they're in for and how much they weigh and who's in charge, etc. On this table here, we might put an IV catheter in their leg or take a blood sample, and everything we need for that is on our rack here. Just behind me, you'll be wondering what this is. Well, this is a dental table, and this is a dental machine. So if your pet is to have a dental, then they will be here, and we can do the procedure. We have gas, this is oxygen coming down from the ceiling, which comes to the anaesthetic circuit. There's one other thing I'd like to show you in here before we move on, and that's these kennels. This is what we call our ICU unit, which means intensive care. So if we have very critically ill patients, they don't have to go into the wards, they can be in this room right in the centre of activity where they can be very, very closely monitored. So we're now in our surgical facility, and this has again been totally upgraded. In fact, we've gone from 1 theatre to 2, and I'd like to take a minute to show you those now. This is the induction area where all the patients are induced with anaesthesia, generally on this table. If you'd like to look through this door here, then this is our old theatre, which is now Theatre 1, mainly for more minor procedures, maybe contaminated ops. And then on the other side, where our kennels used to be, we now have a new theatre, which is our ultra-sterile theatre for orthopaedic surgery, major operations, and anything which needs to be as clean as possible. We've been using these now already for a couple of months, and I'm pleased to say they are working an absolute treat. We're very excited about the wonderful facilities we now have here. So here we are in one of my favourite rooms in the practice, new rooms that we've created. This is our cat ward, and cats, as I'm sure you're aware, don't generally like dogs that much, particularly anxious, barky dogs. So we've created a facility here, soundproof room, nice and warm, nice and calm, where only cats and cat-loving vets and nurses are allowed. So we have an array of cat kennels. It's important for cats that they can't eyeball other cats, so they're all facing the same way. And we have various aids to keeping cats calm, like little houses to go in their kennels. We tend to spend quite a lot of time looking after our inpatients, like Claire is here, giving them a lot of fuss and attention, so that they feel as comfortable and relaxed as they can in the vets. And we find that by keeping them comfortable and relaxed, they allow us to do what we need to do, and our job is a lot easier, and we have happy cats. So to complete the tour, here we have our new dog ward, and we've doubled the number of dog kennels that we have to take account of the growing number of patients we're seeing. Here we have two very large walk-in kennels for the biggest dogs. If you'd like to follow me down here, we have small and medium-sized dog kennels stretching all the way down here. What's particularly nice is just out of the door we've got a nice little area here. So dogs can come out onto this enclosed area here, where there is some washable false fake grass to do their business, and then straight back in. They don't need to go too far. Another lovely facility. So all in all, we're very proud of what we've done here. It's been a hard few months, but we really hope that with these facilities, Lynwood Vets can go to strength to strength and offer better and better services to our clients and better care to their pets. Thanks very much for listening.